Hi guys, it's Dr. Jan in the house. Hey, 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 hey. Oh my gosh, me trying to do my Dougie sitting down. Anyway, so I'm here today for us to talk about C-section versus vaginal delivery, epidural versus no epidural during childbirth. So it is always best, if you can, to avoid having surgery. So as an OBGYN physician, I love performing surgeries. I love doing hysterectomies. I love doing C-sections. But surgeries puts any individual at higher risk of all things that are involved with surgery. So infection, bleeding, injuries to structures that are in the area of operation, and then also anesthesia has its risks associated with it as well. So it's always optimal to avoid surgery if at all possible. If a patient has already had 2 C-sections, and this is her third one, it's advisable that she have another C-section and not try and have a vaginal delivery. There is a risk of that C-section scar on the womb or the uterus coming open while pushing during labor. So that's after having had 2 C-sections. Sometimes after having had 1 C-section, an individual can just decide, no, I just want to go ahead and have another C-section. I don't even want to try and have a vaginal delivery. And then also there's things that we need to think about that can put someone at higher risk of not having a successful vaginal birth after cesarean. That's called VBAC, or TOLAC. That's where they have a trial of labor after a C-section. There's things that can put someone at increased risk of not having this be successful. So that's if the reason for them having a C-section was just baby would not come, they kept pushing, or their cervix wouldn't dilate, if they have a higher BMI, if they're of African American status, if they've never had a vaginal delivery before. There's specific things that we have to think about that can put someone at high risk of having a TOLAC or a trial of labor after a cesarean section not be successful. So those are things that we have to consider. But if a patient, this is kind of her first baby, and she's like, nope, I just want to have a C-section right now. I'm done pushing, or she didn't even want to try pushing, and she was just like, I just want a C-section. If there's really not an indication, it's best to try and avoid it. Having C-sections place someone at higher risk of a lot of complications, even outside of surgery. So I like giving analogies, and hopefully this is helpful. But where your C-section scar is, that tissue is no longer as healthy as other tissues. If you think about, random scars that you have on your skin, if you feel that skin and you feel the rest of your original skin, that place where the scar is a little bit weaker. So the same thing kind of happens with a C-section. That area is weaker. The tissue is not as healthy. So next time you have a pregnancy, the placenta doesn't want to grow on that area. It wants to try and find another area to grow onto. And the placenta is just basically baby's life source. So after baby delivers, then next comes the placenta. So this places someone at higher risk of developing things like a placenta previa or placenta accreta. These are just abnormalities that can take place in pregnancy that can put mom and baby at higher risk of complications as well. So C-sections, if you can avoid it, do so. But there are some indications where you must have a C-section. If baby is kind of facing in the butt down position, a lot of providers are not skilled at doing breech deliveries. That might result in you needing a C-section if you've already had 2 C-sections. There's a lot of other indications, placenta previa, placenta accreta, but there's many indications where a C-section is warranted. Now, epidural versus no epidural. Honestly, this is really up to the patient. So one thing that I would say where it might be in your best interest to get one, so if a patient has like heart disease, where we want to kind of reduce their risk of needing to really bear down and push during labor, they might want to consider getting an epidural early, because that can help make that second stage of labor where they're pushing less strenuous and not really create complications for the heart condition that they have. Or if they maybe have twins and they're going to try and have a vaginal delivery, we normally recommend for them to get an epidural just in case if something goes wrong with the delivery of the second twin or even the first twin, anything of that sort, and it needs to result in an emergency C-section. At least they're already kind of covered in terms of pain control, and we don't have to put them to sleep with general anesthesia. But if it's just kind of like your normal routine Vaginal delivery, it's really up to the mom. If she wants to try and have this baby naturally, cool. If she feels like, nope, there's no point in me having pain, she can also get an epidural. There are also other options. There are IV pain medications that you can get. Once you're past a certain number of centimeters dilated, it is not as advisable that you do get this medication. It can make your baby pretty sleepy after your baby's born. There's also things like nitrous oxide that you just breathe in this substance and it kind of helps to reduce the pain. Of course, with COVID going on right now and everything, that's really not advisable for people to breathe in these substances just because we know how transmission of COVID is. Some people are worried that maybe an epidural will stall out their labor. No, studies really haven't shown that they do that. An epidural can slow down one stage of labor, but then it also speeds up another stage. So at the end of the day, kind of the epidural really doesn't change anything dealing with the labor process. For me, I'm still kind of torn. I kind of want to have a natural birth. I don't know. I feel like I would want to give it a try, but I don't know what childbirth feels like. I've never had a kid before. So I may be like, once the pain is kind of out of control, I may say like, give me an epidural right now. Who knows? Let's see. In maybe some years to come, we'll know the answer. But I hope this was helpful. So I will see you guys on the next video. Bye.